Okay, this is my respiratory patient assessment. Dispatched to a scene with a 3-year-old that has difficulty breathing, a loud seal-like cough, and a hoarse voice. When I arrive, I'm going to do BSI, seems safe, MOI, NOI, and I notice that there's one patient. In this, we would not consider C-spine because it is a respiratory issue. Next, I'm going to do my general impression. The patient is in a tripod position, and I can see a little bit of drool. Next, I check their mental status. They are alert, awake, and responsive. Their chief complaint is that it's hard to breathe and pain in the back of the throat, and it is swollen. When I check the airway, the epiglottis is enlarged, making it difficult to breathe, and there is stridor present. When for breathing, it's just they're having a struggle breathing. Circulation, I notice that the cap refill is good, no internal external bleeding. This is not an immediate transport. It's not as much of an emergency. It still is an emergency, but we can take a stop and look at it. When I took the vitals, I noticed that there's an increased respiratory rate, increased heart rate, and a very high temperature. History, there's no known medications that they're taking, no known allergies. Last oral intake was breakfast. It's about 5 o'clock now in the afternoon. The events leading up, they started in the morning and have worsened throughout the day until what it is now. Interventions, there's nothing that we can do other than to transport. When I do the head to toe, I'm looking for any secondary injuries or emergencies, and I notice nothing. Reassessment, I look at the patient's condition, and it is so far not changing, which is good. And I would assume that this is croup and let the doctors know what I would think, even though it might not be right.